KREM 2 Morning News starts now.
7 o'clock now. Measles in Spokane. For the first time in more than 2 decades, a man in the Lilac City was diagnosed with the deadly virus.
Spokane's first measles case in 21 years, with the patient working and visiting several spots around town. Jenica Villamore is at the Qdoba on the South Hill. That's where this person was working. Rashad Hartnett, Holy Family Hospital, where he sought some care in North Spokane. And Francis Wang is at the North Park Racket Club, a gym he visited, but noting that all these places are open for business this morning, as that risk for measles spreading has passed at this point.
At those particular areas. 7 o'clock this morning. So let's begin this hour with what we do know about this case. The Spokane Regional Health District confirmed to us the patient is still sick at home, but do not believe he is in a contagious situation because he is at home taking care of himself. He's an adult who has never been vaccinated against the disease. The health district is now worried this person, though, may have exposed other people to the virus. It tweeted out, the health district this morning, it is working to identify how the patient was exposed to the measles, and there was no indication of recent travel or contact with a known case. So again, just the beginning of this investigation. We just spoke to the Regional Health District this past hour as they continue that.
We know the infected man is still sick but at home now. We're talking about this measles case here. Spokane Regional Health District says the adult man was never vaccinated, and they said there's no indication he traveled recently, so he likely contracted the virus here.
So either by somebody who lives here or who was coming through the area. The health district is now worried he may have exposed other people to the virus, specifically people who were at the following places where the patient was. And we're talking about the Qdoba on Spokane South Hill on Sunday, April 12th. From 3 to 11 o'clock in the evening. The North Park Racket and Athletic Club on Monday, April 13th. From 1 until 6 o'clock in the evening. Also Franklin Park Urgent Care on Wednesday, April 15th between 3:45 and 7:30 in the evening. And finally, Holy Family Hospital Emergency Department, Thursday, April 16th, overnight from 9:45 until 5 o'clock the next morning. And then again, we're talking on Sunday, April 19th from 11:30 until 7:30.
The health district says the risk to the general public is low because most people have had a measles vaccination. They said if you haven't been vaccinated, they recommend getting one because it can be effective up to 3 days after you might have been exposed to the virus. A person with measles is contagious for 4 days before the rash and for several days after that rash is gone.
People can catch measles as many as 21 days after exposure, but the most common time period is about 10 to 14 days.
Experts say this is not related to the measles outbreak at Disneyland in California. Also, cases on the west side happened too long ago for any of those people to have come in contact with the Spokane patient.
All right, so Lauren Jen just broke down the locations where this person visited, one of them a gym in North Spokane, the North Park Racket and Athletic Club, that's on North Division. Let's go live there this morning, 7:35. Busy time of day for all the folks in there. Health District has been stressing that the virus can't survive maybe more than a couple hours, so that's why the go-ahead is given there for people to come back and work out this morning. Francis.
Yes, Dan. Well, people don't seem worried at all. I'm here at the North Park Racket Club, and I've been speaking with employees and members as they're coming in and going, and some people don't even know about it. Some people are talking about it, but for the most part, they're just shrugging and telling me I've been vaccinated. So clearly, no worries here, especially because there is no longer a risk. Now, the patient did arrive here last Monday, just after 1 o'clock, staying here until 6 p.m., and it's those people who could have been potentially exposed who were here. KREM 2 News spoke with an epidemiologist from the Spokane Regional Health District to see what will be done today to follow up on this patient's current health and the risk of a bigger outbreak in the area.
So we're working with the clinic and the hospital to verify the immune status of those healthcare workers who served the case. And then the hospital and clinics are taking on notifying the persons who were in those areas when the case was there.
Now, Stan, as you mentioned, measles are hard to control because infectious particles can linger in the air. If a person was in a room for an hour, the infectious particles could be around for 2 hours, even after the person leaves. And the epidemiologist says it's just very contagious in a public setting, so it's possible to get it if you are not vaccinated. Now, they also tell me that the infected patient is still sick and staying at home. That patient is no longer contagious at this time. And the Spokane Regional Health District is just currently working with the gym here and the other locations that the person was at to identify and contact the people who were also in the same place during the time when that place was contagious. So within the time range, that 2-hour time frame that the patient had left. Reporting live this morning from the North Park Racquet Club, I'm Frances Wang, KREM 2 News.
All right, Francis, thank you. Some parents opt to delay or even avoid vaccinations based on fear of the shots.
And infectious disease experts insist much of the anxiety about vaccines they believe is based on myth or misinformation, including that vaccines cause autism, a case where the medical community says no, pointing to at least 14 scientific studies having failed to find the link between autism and vaccines. And the myth was fueled by a small flawed study back in 1998, which was later retracted. 4 years later, the author of the study was found guilty of serious misconduct related to that particular study.
Another myth that vaccines contain toxic chemicals like mercury. Doctors say vaccines have never contained mercury and only contain trace amounts of aluminum and formaldehyde.
Another myth, they can cause serious side effects. Studies show vaccines are, in fact, safe. Vaccines are tested in more children over a longer period of time than any other drug, and so far to overwhelmingly safe results. So those are some of the facts that some of the health officials want us to get out about what they believe vaccines could do.
Here at 7:38, earlier on our show on KREM 2, we sat down with Dr. Joel McCullough from the Spokane Regional Health District. He answered several questions about the measles and the vaccine to combat it.
If you're an older person, you contracted the measles years ago, are you immune today, or does that immunity go away?
And generally speaking, people who were born before 1957 are considered immune because they caught the measles naturally and their immune system still remembers their infection. So if you're born before 57, you're considered immune. The initial symptoms of measles are very difficult to tell from your general respiratory illness. The common symptoms are cough, runny nose, runny eyes, and fever before you develop the rash. So it's very difficult to know before the rash if this is measles or just your common cold.
So you're basically not going to say, I have the measles and I know that just because I feel a little different.
Oh,
okay.
No, it's very difficult to tell that.
Since the big issue here is finding out, was anyone else exposed, not just this one particular patient? How can we help you get this information out about what you knew? I'm assuming if you were at one of these locations that we've been talking about and you're just not feeling right, would that be someone you'd want to hear from?
What we're recommending is that people, first of all, check their immune status to make sure that they're up to date on their measles vaccine. And that's number one. And if people are starting to feel ill and they've been in those locations and they're not sure about the immunization status or haven't been immunized, we recommend that they contact their healthcare provider so that they can talk with them and see whether they have the possibility of measles or not.
For the full list of facts versus myths, you can head to our website, krem.com.